In this unit, we are going to be investigating two diseases, one communicable, one non-communicable. We're going to look at the biological basis, how we decide it's one disease, how we would diagnose it, what the treatment would be, what factors are linked to the disease, how we could prevent the disease, and any factors that might hinder the disease being prevented. I'm going to do a communicable disease of influenza. So we're going to look at the first box, the biological base of the disease. We're going to talk around signs, symptoms, tests, treatment and outcome. So first of all, influenza, or flu we will call it through this video, is a viral infection. Okay, it is spread through droplets. It is incubation is 2 to 5 days. Signs and symptoms include fever, aching, cough, runny nose, fatigue. Lasts around about 5 to 10 days. Prognosis is normally, which is our outcome, is full recovery. It only links to the only problems are if we have any complications, and these tend to be in our at-risk groups, which are young or elderly who have immune systems that are weakened or immature. Complications that can link to this are things like pneumonia, bronchitis, meningitis. Tests that we can have for this disease would include a swab that we might take of someone's back of their throat or their nose to test for the viral infection. We might do a blood test again to look for the viral infection and see if that could be isolated on our tests. Treatment, we would be treating the symptoms. We can't treat with antibiotics because it's a virus, and if you remember from our earlier lessons, only bacteria are treated with antibiotics, so we'd be treating with something called antipyretics, or what we would commonly call paracetamol to reduce our temperature so that we can reduce our fever. Rest and fluids. That is generally the only treatment that we would have unless, as I said earlier, we had complications, and then we would have to treat the complications such as meningitis, bronchitis, different diseases like that. What do I mean by a biological basis of the disease? Let's take one sign or symptom, shall we? Let's take fever, when someone has a fever. Well, a fever is caused by two things really. One, the body is trying to get rid of the virus, and the way the body gets rid of the virus is by killing it off, and it kills it off by heating it up. But it can't be specific in what it heats up in terms of the infection. So it heats all of our body up, and therefore we produce heat as it's trying to kill the disease, the virus in this case. But also our body will respond by saying, well, I'm getting really, really hot, so how am I going to get rid of some of this heat? So it gets rid of the heat by us starting to look red and flushed and starting to sweat. And that is because the heat is trying to go out through our skin, through our blood vessels. All our blood vessels will open up, which is something called vasodilate, and the blood will flow to the surface of our skin so that heat can escape through things like evaporation and radiation, which is why we sweat. That would be the water vapour going out of us, trying to cool us down. The other reason that we have a fever is that while our body is trying to attack the disease, it is creating energy, and one of the byproducts of us fighting and creating the energy is heat. And again, as I said earlier, that is how we would try to get rid of it, by things like sweating, by looking red and flushed. Okay, now we'll look at the causes of our disease and our risk factors. So first of all, lifestyle. Let's think about lifestyle. What would increase our risk? Well, a crowded environment, such as students living together, especially those going together in universities, also maybe young students coming to school for the first time. Hygiene, we link that to lifestyle. Washing our hands. Do we wash our hands afterwards? Do we use a tissue? Do we throw it away? Diet, can we link to diet in terms of lifestyle. If we have a poor diet, we're very likely to have a weakened immune system, which means that we're at greater risk of catching infections. Age, as I said earlier, in terms of looking at gender, influenza is not age or gender specific. However, if you have a weakened immune system, then you are more likely to get flu. That will be people who are younger or people who are older or who have an underlying medical condition already. Social class, well, unfortunately, again, we're looking at maybe linking that to our lifestyle in terms of our social class and maybe our environment as well, in terms of maybe those in lower social classes are more likely to get it because of the conditions they live in, the poor lifestyle they may well have, not necessarily, but they may not have a nice healthy diet that has their fresh fruit and veg that would give them the vitamin C they would need. They're more likely to live in crowded housing, maybe damp conditions. They're more likely to have maybe the chronic conditions that are underlying in terms of asthma and heart disease, things like that. Maybe linking to that, we could link in terms of environment and lifestyle, is we could think about our risk factors of if someone within the family has flu, then are people within that environment more likely to get it because they're in contact with them